الدكتورة زهراء العلاق الحاصلة على شهادة الدكتور of Pharmacy Pharm D من جامعة نوفا ساوثرن يونيفرسيتي كولج اوف فارماسي فلوريدا يونايتد ستيت. حقيقة فرصة سعيدة جدا باستضافة الدكتورة. إذا ممكن الموبايلات شوية، احنا حنصور المحاضرة، فإذا ممكن الموبايلات على السالة. وإن شاء الله الدكتورة راح تقدم لنا المحاضرة تتعلق بالفارم دي كوريكولم، باعتبار خريجة الفارم دي مثل ما تعرفون بالولايات المتحدة خريجي الصيدلة جميعا يعني من زمن يطبقون برنامج الفارم دي. احنا بعدنا في طور تحضيرات لهذا البرنامج، فالدكتورة تنقل لنا التجربة مال الولايات المتحدة بهذا البرنامج الدكتور اوف فارماسي، شلون ممكن نستفاد من عنده هنا عندنا بالعراق. فنعطي المايك للدكتورة.
صباح الخير. I would like to thank you all for your time and for being here. أنا زهراء العلاق like we said. أنا عندي الفارم دي شهادة خرجت من نوفا فلوريدا، هي صايرة بأمريكا، وأنا كلش عندي interest in continuing education and education in general. أنا عندي chair بالboard of pharmacy for continuing education. وهاي the presentation is about creating innovative curriculum for Pharm D programs here at the College of Pharmacy. So my objectives in this slide is first I'm going to describe how pharmacy universally is evolving and why the Pharm D program and education is needed. Also I'll give an overview of what it means, what Pharm D program even means and what does it require, and I'll summarize all the educational outcomes for Pharm D programs. I'll highlight major IPPE اللي هي مو foundation but هي council اللي accredits all the College of Pharmacies. So I'll highlight all the major requirements, criteria, and the focus points that they have. I'll summarize general Pharm D curriculum in general, so I'll basically describe it, and I'll explain all the rotations, how they go. So we have introductory pharmacy practice experience, the IPPE, and we have advanced pharmacy practice experience, the APPE. So I'll explain what that means later on. And I'll also explain the concept behind integrated learning, because that's a big thing that's also needed for Pharm D. And I'll provide examples of expected student activities during rotations, which is things that I have done in the past, just being a Pharm D student and graduate. I'll also provide resources for preceptors. So Pharm D application, so one of the things that, what does it mean? What does Pharm D mean? It means it's not just a higher level of education, but it actually deals with the fact that pharmacy practice is evolving. So basically, and I put this slide to just emphasize that, I'm not sure how to, okay, sorry. Okay, so it's going from being product-based. So the way pharmacists are traditionally trained is to know everything there is about the drug. What is the drug? What does it do? How it acts? Dosage formulations, everything. But right now it's evolving towards patient care. Now the issue is, how do we treat the patient? What does the patient have? So for example, in Florida right now, and pretty much also in many countries, when we do rounds, the physician, for example, let's just say that a patient that we have is having infection, the physician would write an antibiotic, for example, vancomycin. We as pharmacists, we take it from there. So at the hospital, we actually order labs, we take the levels, we take creatinine clearance, so we measure the kidney function, and we actually modify the dose every day. So basically, the doctor writes a prescription, and we take it from there. We do everything. So that means that the more pharmacy is evolving, the more responsibilities we have. So that means we need higher education to achieve that. So that's what the implication is. And so this is just an overview. So the degree itself, what is the Pharm D degree actually offers? It offers a lot of opportunities everywhere. So for the most part, it offers clinical opportunities, because in order for pharmacists to function and to work as a clinical pharmacist, you would have to have solid foundation and a lot of experience. So that's what the Pharm D gives. But it also gives opportunities to work in research, teaching, academia, industry, law, and other fields. Also residency, which is like more of a transition state. We have when Pharm D graduates just graduate, if they feel like they need more experience, they could always do residency. And that could last from 1 year to 2 years, depending if they want to specialize or not. So it's basically like a medical degree. It's really it's pretty parallel. It works the same way. As far as entry requirements to the Pharm D, so it requires completion of prerequisite classes. So there are classes that the student would have to take to actually enter the Pharm D. And for the most part, for the vast majority of cases, the entry requires a bachelor degree, which for the most part is 4 years. And the Pharm D program itself is 4 years, so it's 4 plus 4, it's usually 8 years total to have the Pharm D degree. Now, as far as practicing pharmacy in the United States, for students who are graduating in the United States, they actually have to be graduating from an ACPE accredited doctor of pharmacy program. So just an example, there's a pharmacy, there's a college in Florida right now that just opened about 2 years ago. They implemented the Pharm D program, and they're doing great, but they are not accredited yet. So just because it's a Pharm D program doesn't mean that it's accredited. And legally, let's just say hypothetically, the first generation that graduates from this university, let's say that they don't get the accreditation. If they don't, that means they cannot legally work. So even if they have the Pharm D degrees, you cannot work in the United States unless you have an accredited Pharm D degree, which has to be accredited by the ACPE. I'm talking about the new graduates, the people who are just graduating in the United States. People who graduated a long time ago, like 20, 30 years ago, they have different degrees back then. And in different parts of the world, of course, different rules might apply. But legally, you have to graduate from an accredited program. Also, you'd have to complete a certain number of hours in rotations. So these are we do a lot of hours. We do about 1.5 years, almost 2 years of just rotations, which is just being physically on site at the hospital, at different clinics, to actually get the hands-on learning experience. So you actually need that as well. And also you need to pass the board exams, which is the NAPLEX, and also the MPJE, which is the law exam, which actually differs from, in the United States, it differs from one state to another. But you require all of these to actually be able to practice pharmacy in the United States. So here I put it's a wordy slide, but I put all the educational outcomes and goals. So basically, when you set up the curriculum for Pharm D, you'd have to keep those in mind, because your goal ultimately is to accomplish that. Is to basically fulfill all these outcomes for the students that are graduating. So these outcomes is, first one is having foundational knowledge. The students would have to have, of course, they would have to understand everything that they do. So, all the basic science classes, all the pharmaceutical classes, everything. So it's mostly the classwork. Outcome 2 is essential for practice and care. So this is the essentials that every pharmacist, every practitioner needs. And that would be to actually provide care, the patient-centered care. The previous slide, when I put the patient-centered, the evolution one, this one, is to actually focus on the patient. The pharmacist would actually not just know about the drug. It doesn't matter how much the pharmacist knows. Actually, the pharmacist would have to take the patient's interest and work for the patient. So it does require a lot of training as well. So that's the second outcome. Also, the third outcome is approach to the practice and care. So that would be all the skills. This basically means all the things that you need to accomplish that. So all the skills that students would require to actually be able to be a caregiver and a provider. So that would be problem solving, to be a good educator, to be a good communicator, to have cultural sensitivity included. In the United States, there are different races. So, sometimes when you speak, you have to speak in a language that is politically correct. You cannot say things that are harmful. Even, for example, for obesity is a thing, especially in the United States. We have a lot of obese patients. You have to be very careful about the words you use when you talk to the patients. So that requires a lot of communication skills, soft skills, understanding, and sensitivity. These are actual requirements for the accreditation, actually, for the students when they're graduating. So knowledge itself is not enough. They want more. Also, the last outcome is personal and professional development. That just means that the graduating class, they have enough or good leadership. They're self-learner, they have innovation and entrepreneurship, they have professional professionalism in general, so that's also required. So as far as accreditation, it's actually, as I said, it's made by the ACPE, which is Accreditation Council of Pharmacy Practice. So this council, they don't only accredit the new programs, but they also set the standards of what they require for accreditation. So their standards are mostly focused on, of course, against foundational knowledge for students to know all the knowledge that they need, and also the importance of assessments. This is a new thing. I put it here because the ACPE requires all the schools and the universities to continually assess the students all the time, and they need something reliable. I'll actually explain this in a lot more detail later on. I put an outline for the standards in this link. If you click on it, it's about 40, 50 pages. It tells you all the standards. I'll actually just put a little outline here too, but if you want more information, they're all in here. So the major focus areas, basically, just like how we said, pharmacy practice itself is evolving, the ACPE standards are also evolving to match up with the practice. So on the previous focus, I already mentioned these 4 points: the foundational knowledge, essential approach, and the leadership, basically. So these are needed things. But right now, there are newer revisions that they actually are emphasizing the same thing, but they're also adding a couple more points, one of which is for the programs to assess the students, not only their knowledge, but how they apply the knowledge, which means in rotation. So it's pretty much like hands-on job experience for us. And also, the second point that I want to highlight is to develop interprofessional skills, to be a good team player. So these are the standards. I just put a list here just for you to look at. If you're interested in any of those, and more, to have more details on it, you can always go back and visit that link. So there are 25 standards, and they're divided in 3 different sections. One section is the educational outcome, which I already went over. The second section is how to get there, all the processes and procedures to promote and achieve these educational outcomes. The third section is assessments. Like I mentioned, this is a new thing, and it's highly emphasized as well, how the program assesses the students, which means evaluation continually. So as far as the curriculum overview, as I said, pharmacy program itself is 4 years, and this is in addition to the 4 years of bachelor degree, so it's a total 8 years really. And what it is, it offers a combination of both foundational knowledge and applied skills. So not only class work, but a lot of rotation work and hands-on learning experience also. And there's a lot of emphasis on experiential education, which means out of campus, which means that we have to go to different sites, different hospitals, and practice in different settings. So we have IPPE, which is introductory, and then we have advanced APPE. I'll explain both in later slides. So this is just a general, I gave pretty much this is like the schedule of what each year would look like in a Pharm D program. The first year, so the first year, you would have biochemistry. I mean, I don't have to go over each class, but I could. If you're interested, I can tell you, and I can send you more slides, of course. But basically, this is a backbone for all schools to have. For example, I'm graduating from one program. I have friends graduating from a different program. They have different classes. But essentially, they all cover the same foundation. So it's not necessarily the name of the class and when you take it, as much as it's what you should have covered by the time that you graduate. The first year, mostly, we have biochemistry, pathophysiology. I'm just going to go over the major ones. We start to touch the integrated pharmacotherapy. I'll explain what that is later, but that's a series for the rest of the pharmacy program. You'll always have this class, basically, in every year. You also have public health, and we study a healthcare delivery system. So we study, for example, how insurance works, third-party payers. We need to understand everything, not just the science. And mind you, this is the P1, which means the first year of pharmacy school. So this is after you completed the first 4 years of bachelor degree. And we also have laws and ethics, so you have to understand a lot of that as well. The second year, basically the integrated pharmacotherapy series continues. You also have pharmacodynamics. You have pharmacoeconomics and epidemiology. So we do a lot of bioliterature studies. We do look at the literature. We actually study a lot of also what is the impact of economics when it comes to and politics as well when it comes to research and pharmacy itself. And we also have a class for management to be a pharmacy manager, but they still have to take this class because it's a requirement. If you recall in the educational outcomes, there's a whole section just for professionalism and leadership. So you'd have to know how to be a manager as well. This is the second year. The third year basically is focused on a lot of the integrated pharmacotherapy course, which is applied knowledge. So you do a lot of applied knowledge in this year, and then you take another class for law. And you also, throughout, I believe, depending on the school, for us, we did a compounding lab, sterile and non-sterile in the second and the third year. So depending on the school, each program has its own way of offering that. As far as the last year, there's no class, there's no coursework. You don't go to classroom in the fourth year. Everything is based on advanced pharmacy practice, IPPE. So in the last 2 years, the third year and the second year, if you notice here, there's community IPPE and then there's hospital IPPE. This is the introductory pharmacy practice experience. So when you just finish the first year, before starting the second year, you can actually start your rotations. In the second year, before starting the second year, you start your community IPPE, which means retail. So the students would go to different pharmacies and they would do shadowing and they would do their rotations there. And the third year, this becomes more institutional, so it's at the hospital. So the rotation would be taking place in different hospitals. In the fourth year, now the setting is different because it's pretty much everywhere. Because the entire year will be just rotation. So when I graduated, we did 9 rotations. So that's 9 months, because each rotation was 1 month. So 4 weeks for each rotation, and each rotation is 40 hours per week. So it's about 160 hours per rotation per month for 9 months. So it ends up being more than 1,000 overall in total, plus the IPPE. However, the newer version, right now, I graduated doing 9 rotations, but the newer students that will graduate this year, next year, are actually having 7 rotations right now. So I just want to say that the Pharm D program is not set on stone. It's constantly changing. They're always, switching things up and trying to see if something works or if it doesn't. So the difference between 9 rotations and 7 rotations is that, in my opinion, I think I did 9 rotations, so I was at 9 different hospitals or 9 different sites. I feel like I had a pretty well-rounded experience because I saw many things, different things. The newer students are only seeing 7 things instead of 9. So in my opinion, my generation, let's say, I feel like we are more well-rounded than the newer class. However, they have 6 weeks when we only had 4. So that's just a matter of how much you want to learn each rotation. But there are rotations. For example, just to give you an example, I did an MTM rotation, which is the medication therapy management, and I came up with the idea to design a little survey. So there were a lot of hospital admissions, patients going to the emergency room for migraine, for headache. And that shouldn't be happening because they should be on medications that prevent that. And it's very expensive too. So when that happens, something is wrong. So we figured to make a survey and call the patients to see what's going on with them. Is it that they don't have the medications to prevent the headache? Or is it that it's too expensive for them to buy? Or is it that they take it but they don't like the side effect? It's giving them something so they don't take it. It's just a matter of patient adherence. So we just needed to know how to tackle it because pharmacists can actually solve that problem. We can do patient counseling. We can actually, if they don't like it or if they can't afford it, we can offer a different medication that's cheaper. That way it prevents all the hospital admissions that are very costly. Just an example. So in this rotation, we came up with this idea by the 3rd week. And we did a lot of work, a lot of data collection, but by the time we were just about to, to actually start to write it and publish it, I was in my next rotation because it was the 4th week ended, and I have to be physically there to do it. So I was actually deprived from that experience, at least for the rest of it. So that's just an example why maybe longer duration for each rotation might be a better idea sometimes. Just something for you to think about. And I have this set up here. If you'd like, you can click on the link. It's a PDF, and it tells you exactly what each rotation, what should it be. So some of them are internal medicine, ambulatory care. Some of them are electives. So there are ones that are electives. There are ones that are required. So this tells you the exact setup for that. It's actually a nice worksheet too. You could provide it for students in case you want to implement something similar to that. This is an example of my own schedule when I did last year. This was my last year, my P4 year. Notice that I did 9 rotations. So in July, I did inpatient oncology, just to give you an example. So that was cancer, inpatient. In August, I did advanced community. So that was at Walgreens. Walgreens is a really popular brand for just retail pharmacy. So that was one of my rotations. One of them was internal medicine at Jackson Memorial. One of them was ambulatory care. So the ambulatory care means, by definition, it means the patient can actually ambulate. So you have people walking into your clinic, and you provide a lot of patient counseling. In the United States, this is highly growing, and it provides great opportunities for pharmacists to actually counsel patients on their medications. So that one was actually at Cleveland Clinic, and it was a specialized transplant clinic. So basically, we had half the rotation was actually inpatient. So we would go in the morning, say from 8 to 12, and we do rounds with the physician. So we have patients coming in with new, organ rejection, or they have a new transplant, or they need something. So this is half of it is inpatient, and from 12 all the way to 4, we would be at the clinic counseling and seeing the patients that will always be taking the medications, because when you have transplant, you will be put on immunosuppressant medications for the rest of your life. So, and there are a lot of medications, a lot of pills per day. So the patients get confused. They don't know which medication to take. They miss medication. They don't like side effects. So we have to see them. We're required to see them every single week. And I'm talking about the pharmacist, not the physician. It's the pharmacist's job. So every day, we spend about 4 hours seeing patients at the clinic to manage their medications. That was actually one of my favorite rotations, because it had a lot of patient interaction. The other rotation was geriatrics. So we went to a lot of nursing homes. And December was off. January, I did medication therapy management, which again is another actually trend that's highly growing in pretty much, I want to say universally as well. And February, I did critical care. March, I did internal medicine too. So I wanted to take more of internal medicine. And April, I had infectious disease. That was another elective I take. The good thing about having more than 7 rotations is that you get to have more electives as well. So the student can actually individualize their schedule like I did. So far I covered everything that, what the rotations are, what they should be, how they're set up, how long they are, but I didn't say anything about what students should be doing inside the rotation in the hospital. These are examples. They're hard to see, but basically I can go over more real-life examples later on in my slides, just to give examples of things that I did. It's easier for me to talk about my experience versus something that's just theoretical. But the idea here is that in IPPE, which is 2nd and 3rd year, they have to start shadowing, they have to start being more involved. And as time goes by the 4th year, if you notice there's more responsibilities, but they also get more complicated. So in APPE, we have a lot more responsibilities. I had rotations where I rounded with a physician myself. There was no pharmacist that was licensed. It was me. So that's something that an IPPE student cannot do, because they don't have the knowledge foundation. We finished all the classworks. But the last year, this is like, it's as if we graduated and we're working, but it's a job training experience for us, really. So this is an example. It's really hard to see, unfortunately, but I could just say things just to specify what activities the students should be doing in rotations, and what they are actually also graded on. So in the oncology rotation, for example, I rounded with a physician. I did a lot of medication counseling. And when you have cancer patients, they are vulnerable to having infections. So we have febrile neutropenia. That's something that the pharmacist can do a lot for. So that's something I did as well. I did provide a lot of recommendations, if not rounds as well. And the second rotation, advanced community, which is at Walgreens. So yes, it's a retail pharmacy, but we didn't just sit there and give medications. It was a lot more complicated than that. Actually, they had us go to, here, I have it as, we went to different specialty pharmacies. So in the US, there is a retail pharmacy, but it's only for HIV patients, or only for transplant patients, only for oncology patients. So I had a chance to actually work in all of those. And they're actually highly different because you do a lot of patient counseling. We also did bedside. Bedside service is another trend. So basically you have a hospital and you have the patients, you give medications throughout the hospital stay. But when the when the patients are discharged, so they feel better, they're discharged, now you're writing new prescriptions to them. But you're waiting for them to go to their own pharmacy and pick up that prescription. A lot of patients, when they leave the hospital, they're on painkillers, opioids, and things that are sedative. They probably won't do it. They won't pick up the prescription. What that means is that lack of adherence. So you want to ensure that there's no gap. Every patient is taking the medication they should be taking. So what the hospitals do, actually, not all of them, but right now it's a new trend. They have a service called bedside service. They have a pharmacy inside the hospital, and when they write new prescriptions for discharge, they give it to the pharmacy, and the patients would take the medications as they leave the hospital. This offers great opportunities for Pharm D graduates as well, because they're doing retail pharmacy, but it's at a clinic, at a hospital or a clinic. Internal medicine, again, in this rotation, I did a lot of anticoagulation adjustments. So we have patients that are on warfarin, and that's a medication that causes, it prevents clots, but it also causes bleeding. So I would look at the INR. I would actually order labs every day. I would check the results, and I would do those modifications. If the patient is at risk for bleeding, I would hold the medication. I would stop the physician from giving it. And that's our responsibility, the pharmacist's responsibilities. And I did this firsthand, so that was something good as well. And the students should actually do that also. And I did perform IV to PO conversions. So when the patients leave the hospital, they're switched from just tablets, taking PO medication, they switch from having IV to having tablet medications. So in order for this to happen, the pharmacist will have to go and check if the patient can tolerate taking something by mouth. Because not all the time, if the patient is vomiting, they can't. So you'd have to look at every single patient that leaves the hospital to make sure that they qualify for a PO, IV to PO conversion. And I did that as well. I can go into more details and all the other rotations, but this is just to give you a general idea. Rounds, for example, as far as rounds, you do that in every rotation. This is required for pharmacists to do. And critical care rotation, I want to highlight that we did a lot of TPN, which is the total parental nutrition. So we actually not only prepared the bag, but we actually order labs to see the electrolytes every single day and everything. And we actually, we made modifications every single day. So that one I did as well. And everything else is highly, it's sort of repetitive, but we did a lot of patient counseling as well. For example, MedRex, which is medication reconciliation. So you're at any hospital, it doesn't have to be an emergency room. You have patients coming in with any reason that brought them in, but you don't know which medication they take at home. Now, a lot of times you could ask the patient, but a lot of times, people, and the trend is to just go on the computer, because in the United States, everything is connected. So you would just look, put their name, their information, and everything should pop up, everything about their information, and the last medication they took anywhere. So that way you should get a good history of everything they have. But it's not complete, so you have to make sure that's something that's actually reliable. I myself I would catch an error every 2 days, 3 days, just doing this. I would talk to the patient, I would ask them, what are you taking? They say something, and it's not in the history. We need to make sure that we take all the medication the patient is taking. For example, what if we give them something that interacts with something they take, but we don't know they take it? we can actually kill a patient by accident. I'm just saying, so this is required for Pharm D graduates and students to be doing as well. It's called medication and reconciliation. An infectious disease, I did that as well, and I did the vancomycin dosing and aminoglycoside dosing. So I did all of that, and I just did this. These 2 slides are just my last year. And these are the things that are required, actually. So as far as assessments, I mentioned that the ACPE is highly emphasizing on assessing the students. There are 3 main points that I want to highlight here. The first one is when the students go on rounds or just in rotations, it's not the professor who will be doing the grading. It's really the preceptor. So this person is already a clinician that's working at this clinic or hospital or site that's seeing the patient and working with them every day. So this is the person that will be grading the student. And the second point I want to highlight is that the program, so ACPE requires, in order for you to have an accredited Pharm D program, you'd have to, as I said, you'd have to continually evaluate your students, but you'd have to use words specific to describe how they do. In rotations, for example, it's not like pass or fail, because we have classes that are black and white. You either pass or you don't. IPPE are pass and fail. So far, right now, they're pass and fail. You either do good or you don't do good. So it's pretty, simple. But the last year, you have to, each rotation I had, each preceptor described every single activity I did in words like adequate, sufficient, appropriate, things like that. And if it was good, it's proficient. I'll actually, maybe, I don't know, does, if the link here works. Let me see. Okay. What I put here is I put a link to show you exactly what the ACPE requires.
Right there.
No. Yeah. Well, I have it for your information. I can always send it. But basically, if you click on it, it tells you there's a list about 20 to 30, maybe even more, maybe 40 different activities that the students do in their last year that the preceptor would have to evaluate. And it would be something like deficient. So if the student is not doing well, it's deficient. Sufficient, fair, neutral. There's also proficient, which is really good. But there's also, I believe it's outstanding. It's something even better. It's an A+. So they're very specific about each activity. And the last grade that you have in each rotation is the average of everything. Now, the third point I want to mention that, so in each rotation, not only we get graded once, so the preceptor would see you once, or they grade you once, they would actually have to come back and they grade you again to see how you progress. So one thing I want to emphasize, the progression, student progression. When you assess the students, you don't just assess how well they do in one exam. You have to see how much did they improve in this rotation. No matter how, even if they're very smart, if they're good, if they didn't improve, they didn't learn much, that means they probably weren't doing something they should be doing in the rotation. So for example, for me, in the second week, I was evaluated and I had a grade. And in the fourth week, I was also evaluated and had a different grade. And the last grade is the average of the both. And this is in each rotation. Everything I said so far is about APPE, the advanced rotation. I didn't talk about IPPE as much, only because IPPE is just a smaller, simpler version of APPE, really. The ACPE requires a minimum of 300 hours of APPE experience. So that's in your second and third year. You should be able to accomplish, to have the students accomplish a total of at least 300 hours of rotation work. Now, it also requires a balance between community and institutional, hospital. So 150 hours, about, give or take, 150 hours in the retail pharmacy and 150 hours in institutions, hospitals, clinic, and such. So they want I just want to emphasize that the graduating class, it doesn't matter what they like to work in. They have to have experience everywhere. They have to be good at retail, they have to be good in hospital, they have to be good communicators, teachers, everything. So this is something you could actually see just from the requirements, how it's spread out everywhere. It's important to have this balance. In my own, in Nova, Southeastern University, we did, in the second year, we did 60 hours community 1, 60 hours of community 2. So that's in the second year, so it was about 120 hours. In the third year, we did 120 hours and 120 hours. It was like 240 hours. In total, it was 360 hours. So we exceeded that. And that's one reason why we're actually accredited by the ACPE. Mind you, again, I just want to mention that this is IPPE. So this is second and third year, not fourth year. Fourth year is 9 rotations or 7, but it's 9 months minimum. This is a concept that I want to highlight, and I also want to give more information on. If you recall, when I was showing you the schedule itself, there was integrated pharmacotherapy course, and it went as, the first year you have 1, second year you have 2 or 3. Every semester you would have an integrated pharmacotherapy course, and it keeps evolving with you. So what that is and this is what they want. They want the students who are graduating to have integrated knowledge. So what does this mean? So for example, medicinal chemistry is the basic foundation. So it's you understanding what the drug looks like, the molecules, how it acts, the mechanism of action, things like that. This is medicinal chemistry. But as time goes by, you have more pharmacology knowledge on it, so your knowledge builds up. And then you have therapeutics. Now if you remember the slide where I had the pills and I had the patients, now you understood the pills, but now you understand the patients. So therapeutics is offering therapy. So this is when you actually know disease states. Just to give you an example, for example, psychiatry. So we have antidepressants such as SSRI, SNRIs that are famous, well-known families that are used to treat depression, for example. So in medicinal chemistry, in the first year, for example, we started to know what SSRIs look like, how they act, things, the families, things of that nature. Then we had pharmacology, more pharmacology courses. So the knowledge was building up. Then we had therapeutics. So in therapeutics courses, we learned about, now we're learning about the patient, remember. So now we're looking at, okay, so what is depression? What is anxiety? What is PTSD, for example? What is all the everything, all the details about the disease states also, so that we know how to treat the patients. Then, in the last stage, this is when you have case studies. Now you're applying. So now you're not being, for example, in pharmacotherapy integrated course, you would have, in the exam, you'd have questions. They're asking you, they just give you a case, a real life case, and you have to solve the case. So now it's all about applying. And this is what they want. They don't want somebody who knows all the who just memorizes all the information. They want someone who can apply it and is ready to actually practice in real life when they graduate. So this is why integrated pharmacotherapy courses are needed, and they're highly spread out throughout the curriculum as well. So as far as, I'm not a preceptor myself, but I tried to find information for preceptorship. So for all the, and when you implement a Pharm D program, now you have to train the students. So you have to have preceptorship skills and resources. So I put some of them here. We have pharmacist letters. So this is I don't know about here, but in the US, this is a great resource for pharmacists in terms of training students, in terms of their jobs, CEs, continuing education, how to keep up with everything. So I put the link here. Also, this is my own personal experience. So I had a lot of preceptors. And again, I want to mention, just to define preceptor. Preceptor could be anybody who is working at the hospital who is training you, and they're grading you. So that's a preceptor. It's somebody who's, in a way, your boss, but not really your boss, because you're not being paid, you're a student. So they're training with you, they're teaching you, but they're also training you. So it requires more than just teaching. It requires, it's like being a good manager and good trainer as well. So in my opinion, I had 9 preceptors in my last year, and I liked all of them, but there are ones that I liked more than others, of course. And I remember one preceptor asking me questions before I started the rotation. It was my first day, and she sat down with me, we had coffee, and she asked me questions, and she was asking me about what my strengths are. So what is it, something that I feel like I'm good at in general? For me, it's I'm very detail oriented. So I like having details, and I'm very focused on, I can't, if you give me a book, I would try to read every detail, every page in it. So that's my own strength. She asked me what I like to accomplish, and what do I like to improve on myself. So now think about it. This preceptor was a faculty at the hospital. The hospital has a lot of projects, and they need someone to help them with them. Now, some of these projects require somebody who is really good with details. So she gave me a lot of special projects to do that require detailed orientation. So in a way, I helped her with your project. So I helped the hospital. So she gained, but I also gained because I liked that experience. I improved myself, and I got a chance to actually even improve my own strength. So, and I feel like when preceptors do this with the students, when they sit down, get to know the students, and when they do that, I think the students get a lot more motivated because they feel like they own the experience. It's not homework anymore, it's their own project. So this is very, psychologically speaking, this is very good strategy for preceptors to actually get students to be more involved. I also put a couple more articles that are fairly new that have a lot of helpful tips for preceptors. And I'm almost done, but in here I just want to mention that in my own program, it was highly diverse. So you saw the curriculum, you saw that each year has a lot of classes and a lot of rotations, but at the end, I think a good Pharm D program should offer opportunities to do everything. It's a journey, because by the time you graduate, you're a professional, you're a clinical pharmacist, or anything you like, but you should be highly, you have to have the soft people skills, you have to have the leadership, you have to have the involvement, not just the knowledge, the book knowledge, and even the clinical knowledge. So, and I think the fact that, for example, I was giving rotations. So throughout rotations, I got to know the practitioners, the preceptors, the other pharmacists, the physicians, the nurses, and this gave me opportunities to be involved, to do a lot of activities, volunteering for patients. So for example, in here I did a Genes for Genes Day. We've raised funds for kids with rare genetic disease. Because I learned this throughout not only books, but in rotations, and this was repeated until I actually got a chance to do it. And so in general, I think having just classwork, a program that only offers classes, if I had that, I wouldn't be able to do this. So I think a really good program should offer you all the opportunities to be as well-rounded as you can, because it's overall a good journey, and it should be informative, good, and also fun. Questions?
Thank you so much.
Of course.
Thank you so much, Dr. Thank you for your time and for your efforts. We really enjoyed the Pharm D program. I have maybe 3 questions.
Okay,
One of them, we have bachelor degree in Iraq. We don't have Pharm D yet. So people wondering about basic science, where they should teach the basic science. Is it? You mentioned something about chemistry in the first year. You built up the pharmacology, then you built up the therapeutics.
Okay.
But what about the bachelor degree before? They call it pre-pharmacy degree, because some basic science before you go to pharmacy school.
Yes. Okay. I highlighted that. I didn't put all the information there, but I would be happy to actually provide you with additional information. Yeah, of course. So yes, you're right. So in the first year, you do biochemistry, for example. You do classes like that, but you do, before even getting into Pharm D, you would have to have foundational classes. So there are prerequisites, or pre-pharmacy as you call it, before entering the pharmacy program. So some of them are, I'll actually explain that. So each program has its own, sometimes each program is unique, but the majority of programs would require you to have, for example, microbiology. That's one example.
Specific hours, how?
I think for my own, again, each program is different. For me, it was 4. It was 3 hours of lecture and 1 hour of lab. So it was 4 credit hours. So that was just, why? Because the Pharm D program, some pharmacy programs offer microbiology classes as an elective, but if you saw the backbone, it didn't have microbiology. And when you graduate, you'll be working with antibiotics. So you need to know a lot of microbiology as well. So there's a reason why they have all the prerequisites. Biochemistry is prerequisites for some classes, for some Pharm D programs. Some of them require genetics, not all of them. So that's specific to the school, but there's a specific framework that I have. I didn't include it because it's part of the prerequisites before pharmacy, but I'll be happy to send you that.
Because I know, at the University of Iowa, from where I graduated, we have only one pharmacy lab, pharmacy practice lab. And it's integrated lab. It has has a small experiment from chemistry to pharmaceutics to clinical pharmacy. It seems all in one lab, because here in the college we have 3 floors, and each floor has so many labs.
It's great. Yeah.
We're taking the labs independently. In my Pharm D program, we have only one room and everything in this room.
It's very crowded. That's for me. We had 2 rooms.
Okay.
We had an additional room, but it was also
just 2 rooms
highly
for labs.
crowded. It was very crowded. I think it's great to have more rooms because that way you can get you could do a lot more labs because you do have compounding, you have pharmacy experience as just for example, patient counseling. That's its own lab. So you do if you have more labs, that's even better. One throughout the pharmacy program, the Pharm D, which is I believe. I'm not sure for you, it could be the last 3 years or the last 2 years, but in those years, it's good to have a certain number of labs because one, it can be crowded because you'd have the first year, second year. For us, it would be 4 years, 3 years actually, 3 years on campus. So P1, P2, P3, and each of them have some kind of lab going on. So it would be really crowded to have a lot of people come in one lab. If that was your question.
Thanks. I also have 2 more questions.
Of course,
then
yeah.
I will leave the question
Of course.
for that. One about the volunteer, because I know that in Pharm D program that you have like so many volunteers during the year.
Yes.
And is it required to have those volunteers?
Okay.
Because I know after graduation, you need to apply for, some of you may apply for residency, and you need to compete. And if you don't have this like credits or volunteer or community services, you cannot compete.
Yes,
Could you just elaborate about this?
Exactly, that's very true. It's very hard to see in this slide, but I can provide you with a specific source and also the picture. But in the first year, and this is very important to tackle the students when they're fresh. When they come in, a lot of people go to class, take notes, go home, take a nap, and move on. They don't want to be involved. It's very, in the first 1 and 2 years, really, you want to get the message to them that in real life you need to have experience, and it's hard to find jobs without any kind of experience. So what the Pharm D program itself did, and that's by the IPPE also, is that I believe it's in professional development. So if you recall, one of the outcomes itself was a professional development. So you need to be a good leader, communicator, to have soft skills. So actually in my school and in a lot of schools, even in this setup, you'd have to have a certain number of hours in your first year.
So it's required.
It's a class, technically.
So it's volunteer, but it's not volunteer, it's obligation kind of.
Exactly. That's how they say it, yeah. So basically, you don't go to class really, but what it is you have like a worksheet, and you would have to do, let's say, you have to be involved in 10 different projects. So it could be anything. It could be diabetes. It could be a volunteer activity at some hospital. It could be,
outside the college.
Outside the college, or it could be inside. But for the most part, I like to do it outside to explore. So it could be anywhere. And when you do it, at the end, you get the preceptor or whoever to sign. So by the end, you would have to have a list of all these, the preceptor's signature, and you have to have at least 10 to pass this class. It's a pass or fail. So if you don't, you fail, and if you fail, you have to repeat the whole year. So no one would risk that. But it's implemented in the program. And as far as you're saying, it adds competitive edge to your resume when you're involved. Even just more than just 10 activities. You want to do a lot more activities to be involved. And to have because it's competitive. Having jobs, everything is more competitive. Think of Pharm D as medical degree. It's the same, it's parallel, but we have 8 years, we put in 8 years, but by the time we graduate, you have people, they keep wanting to compete. And so there's residency, there are jobs, there are different offers, but there's competition. And people want to distinguish themselves. So the more experience you have, the more volunteer activities you have, the more leadership roles you have, the better, the more competitive you get. So I suggest that even though you emphasize this to the students, that they have to have a minimum required things or activities, they really want more. It's just for their own good.
Thank you so much.
Yeah, of course.
Thank you, Dr. Zahraa, for your interesting talk. We really enjoyed it.
Of course, thank you.
I just want to add something. You mentioned more than one time the program is 8 years. You're talking about the program you graduated from. Because, as I know, most of Pharm D programs in US, they are 6 years program. Like 2 years preschool, taking general science like OChem, biology, microbiology, so on. And then after that, they will be qualified to go into the Pharm D program, which is usually 4 years, like you mentioned.
Okay.
So I think, 8 years is scary. for students.
That's true.
Spend 8 years to get
Yeah.
a degree is not worth it, I think.
Yeah.
I'm so scared for decision makers here in the College of Pharmacy.
Right. Okay, so that's a good point that you brought up. Okay, so the Pharm D itself is 4 years, and that's the last 4 years. Before that, it's bachelor degree. Or some people, the people who do 6 years, they're ones who, because in order for you to have a bachelor degree, usually in anything, could be even literature, which has nothing to do with pharmacy, right? But that typically all in the United States is usually 4 years, 4 to 5. If you do engineering, it's actually 5. So that's why I said 8, because on average, the majority of cases, it takes about 8 years to be a pharmacist. But you're saying if you already know what you want and you're here and you're set up for pharmacy from year 1, you don't have to waste your time for 4 years to have a bachelor degree. In other words, not that it's my own advice, but I'm just saying there are people who know what they want, and the people who do 6 years, actually, they're the exception. They're the people who don't have the bachelor degree, which may not make sense. How do you have a Pharm D but no bachelor degree? But what they did, if I actually put it in one of the slides, just to go back to that, they have prerequisites. So there are prerequisites that you have. And these are the classes that also you asked me about. So they're including organic chemistry, so microbiology, organic chemistry. If you add them up, they end up being, it takes about 2.5 years, 2 years if you really cram it together. Some students know what they want and they take those 2, because they know they want pharmacy from the moment they graduate high school. So they take those classes together and they can potentially do 2 years. But I personally don't know anybody who did it in 6 years. Most people finish bachelor degree.
I know many schools doing this, because after second year, they do like qualifying exam or maybe interview.
PCATs, yes.
They will be qualified, they go to Pharm. If not, they finish the bachelor.
The bachelor degree.
Take another,
You could always take another shot, yeah.
And get bachelor in
Right.
maybe medicinal chemistry or maybe pharmaceutics and so on.
Yes, yeah.
Like I know, maybe other schools have 8 years.
Right. I think, I'm not sure about the statistics, but as far as I know, it's not. So okay. So the requirements legally, of course, is 4 years plus their prerequisites. Some schools, actually, I want to say the University of Maryland, but I could be wrong, because I remember when I was looking at different schools, some schools actually require a bachelor degree. So it requires you to have 8 years total, regardless, or even more if you're, again, if you finished engineering in the first 5 years or 4 years. But again, in my own experience, that's the exception. I don't know about the statistics, so I can't tell you what the majority is. That's my own experience, and I graduated from Florida. But it's definitely, if you're asking me if it's possible, it's definitely possible. You could do 2 years, and if you do well in the 2 years, if you cram it all together, and then you apply, and then you get accepted, and the school actually is okay with you not having a bachelor degree, but finishing the prerequisites is good, then you can actually finish it in 6 years. It's doable. Yes.
Thank you for this lecture. I would like to ask you about this Pharm D degree. Is it academic degree or is it a professional degree?
It's professional. Okay, so you're asking in a way if you want to compare it to a PhD, is this something? No. Okay, okay. It's really both, but it's professional. It's more a professional degree.
Professional degree?
Health professional degree.
Health professional.
Yes.
So the responsibility, and I think it is not enough, the responsibility for, what is the term of the pharmacist after graduation from this degree? Is it a clinical pharmacist? Is it what?
Okay.
Is it a training pharmacist after graduation from this degree?
Okay, a clinical pharmacist.
As a clinical pharmacist?
Yes, if I right now apply to a hospital job, I just graduated. So you can take me for an example. If I apply to a hospital, in a hospital, and I want to work, when I have this job, I will be called clinical pharmacist. The reason why I don't say every graduate is a clinical pharmacist is because some people are interested in different things. So some people like to work in retail. And if you recall, it's required for all pharmacists to have a Pharm D degrees. So it's not fair to say everybody has to be a clinical pharmacist. But you have all what it takes to be a clinical pharmacist. You can think of it as a clinical pharmacist though. I know in here, I've heard different things. I heard that when you graduate, if you want to be a clinical pharmacist, you could potentially do a year or 2 after that something of that nature, then you can be called clinical pharmacist. Now, this could be equivalent to the Pharm D degrees, based on how I understand the differences. But it's clinical in nature, so it definitely is. I mean, you spend about like a year and a half, almost 2 years, just being on rotations. So that's enough to make you a clinical pharmacist.
Do you think that the responsibility of this clinical, just reminding the patient about the dose or side effect complications, post-treatment complications?
Everything. So that's a good question. So I want to say, so yes, when you're a clinical pharmacist, there's a whole range of responsibilities that you have. It could go anywhere from just...
You can prescribe?
That's also a good question. You can, some states allow that. There are actually medications that you could legally order. They call it order. So you can order medications as a Pharm D graduate, actually. But technically, you don't always see that, because there's a physician who can do that. So the pharmacist, remember, when you're prescribing, you're having reliability and responsibility of that. So even when you can, technically, you don't see that. But legally, you can in some states, and there are limits to what you can prescribe. So you don't see a pharmacist who can prescribe everything. If they're specialized and if they're trained in certain areas, they can prescribe that. I personally have shadowed and I worked with a pharmacist who prescribes diabetes medications, because she works in a diabetic center, so it's a clinic, and she actually prescribes that herself, because the physician has a lot of patients to see and they're busy and they don't have time to sit down with each patient, so the pharmacist does that. And she's qualified, she's a Pharm D graduate, she has that experience. I believe she even finished residency. So it's, the more experience you have, the more you can do that. But you definitely can. And the range of responsibilities for clinical pharmacists is wide range. You do sit down with the clients, you do patient counseling, you verify orders. So for example, when the physician writes prescription, in the United States, the pharmacist actually has to approve of it, in a way. The only situation where the physician can write and give it to the patient without the pharmacist being there and approving is in an emergency situation. Why? Because the time limits. The patient comes in bleeding, car accident, something like that. This is the only, at least legally. So the pharmacist actually has to approve of that. Just to give you a legal example of why Pharm D graduates are needed, and everywhere in the hospital, especially. Yeah. Of course.
I may have a question.
Yes.
I know you just graduated with Pharm D program. As a fresh graduate, I can notice the presentation skills, or these,
Yes.
So what about the program focusing on non-educational stuff, like the skills, presentation skills? How can they give you the opportunity to improve your presentation skills,
yes,
your interactions, your communications? Because I know, as I noticed, you're just fresh, because any fresh graduate, you may ask her or her to present, you may hesitate. But I know they focus on the presentation skills, because they need you to go there in the field, and you can communicate with the physician,
Yes.
العفو ممكن اذكركم ممكن تاخذون عصاير وكيك اي واحد يقدر يطلع يعني اثناء الطلعه مالته. help yourself. عذرا ما قدرنا نوزعها بس هي موجوده هناك. يعني اي واحد يطلع يقدر ياخذ طلعته. شكرا دكتور. العفو ما قدرنا نوزعكم اياها. What about this? Do you have any?
Okay, yeah, no, that's a great question. And so I want to actually quote something that ACPE, the newer revisions.
They can explain to the...
Yes. So the newer revisions of the ACPE are highlighting that the graduating class, the Pharm D, they have to be two things: practice ready. So if you take them and throw them in a hospital, they have to be ready to practice clinical pharmacy. If you put them in a clinic, they have to know at least the basics of how to work a clinic. Retail, same thing. And they also have to be team players. So in order for you to be a good team player, so think of the pharmacist in the United States. And it's pretty much, it's going to be everywhere at some point, really. You're working with the physician, with the nurse, with the patients. You're also a preceptor. The fact that you work means that the programs, the universities will send you students, so you'll be training at the same time. So anybody who's working needs to have at least minimum communication skills, leadership skills, management skills, and soft skills and that's required actually. So how do they actually, the question is how to assure that? How do you develop a program that actually gives the students opportunities for that? So in my own program, one of the prerequisites, so before even entering the Pharm D program, I had to have speech. So it was a 3-credit class, and in that class I had to give at least 3-4 different presentations. This is, you know, for you guys, this is like the first few years of your college experience. So I have to have that before even entering Pharm D. And in the Pharm D, there will definitely be a lot of presentations. Some of them are required. So we did, for example, we did a research. So every time you do, research is actually a class by itself. I believe it's a 3-credit class. When you do that, you have to present. And for us, for example, we did research on a pill box, and it was something related to how patients can keep their pills together. They don't, you know, to ensure their adherence, how they store the medications. So we have actually different companies. It was really intimidating for a second-year P2 student to actually give speech in front of companies, because there are people who are actually willing to buy your product, you know, what we just did. So it's intimidating, but you always have mentorships. You have, yeah, I also want to emphasize that, because Pharm D can be really difficult, but you have have a counselor inside the school, you have a preceptor with you, you also have your own mentor for each topic that they give, or each big project. You have a mentor who is responsible for your project, and this is a faculty member. Also, you have friends and things of that nature. So there will always be support system, but there are at least, I believe I did at least like 10 to 15 different presentations throughout the Pharm D programs, and at least a few more before that. That's just a minimum. And in each rotation in the last year, each rotation, I wish I actually show you the grading, the little criteria of what they do to grade you. One of the criteria, there's a whole section of how you present. So how the preceptors know how the student is good presenting. So each rotation, they give you a presentation. You pick a patient or a case throughout your 4 weeks or 6 weeks, and then you have to learn everything about it, and then you present it to the physician, to the nurse, to the pharmacist. I did present to the patients, so it was, I also have to understand the language. So the patients, they get scared when they hear about a big term. You know, I can't say this causes internal bleeding. That's a big word, and they get scared. So I have to know who am I talking to. So they require for me to have different types of presentations, especially in my last year. Yeah.
Last question for me.
Of course.
We have, like here in the College of Pharmacy, we have graduate study in clinical pharmacy. I know in the US they have what you call it residency program. You have PGY1
Yes.
for community or hospital. You have PGY2. I know that the market is really competitive now.
Yes.
If you need to apply for a job, your resume should be good, because
Yes.
so many Pharm D graduate
Yes.
at the same year.
Yes.
So could you give it, just summarize? What do you think about going to the residency?
Mm-hmm.
What do you need for the residency? At the same time, the process of applying for a job and getting a job as a Pharm D graduate.
Okay, yes. So residency, and there's also fellowship as well. It's highly competitive. So what residency is, it's an option. So after you finish the Pharm D, it's not required for you to have a job. So you can have a job without residency, but it's recommended, and it's very useful actually. And it's just like medical residency. You see medical residents, they are working, they also get paid, but they are still on training. So the last year, the IPPE, if you think this is not enough, or if the job, if you apply to a hospital and they say we need more experience, we only hire residents, for example. Another reason is because of the saturation. A lot of people are graduating with Pharm D right now in the United States. So some people want to be more competitive, so they actually add and they do residency. And it could be anywhere. It could be in clinical. For the most part, it's in clinical, so in a hospital. But it could also be community. It could be at a retail. Like, for example, when I mentioned the specialty care, the HIV, transplant, oncology, pharmacy. It's a pharmacy down the road. It's just a pharmacy, but it's only for these patients. So it's special. When you actually work there, you're a specialized pharmacist, even though you're working in retail. Now, as far as the question is, how do how is that, there's really no one way to kind of give you an overview of how that works, but you can apply for jobs. You know, you actually have for residency, there's like a central application you have to fill out, and you have certain requirements. The requirements, for the most part, are vague. They're having letters of recommendation. They don't tell you the grade, but they want high grades as well.
Is it like the letter of recommendations directly from your advisor to the program, or you can carry this letter by?
Oh no, it's directly. It's actually directly. You cannot you cannot do that. You can have an option sometimes to read it, but they submit it. So I have an interesting experience. So sometimes you have the preceptor or professor write you a letter, not to you, to the central application or to the site. So what happens if you're interested in at least you don't even know what they wrote. It could be something bad, or it could be something good. I mean, I'm assuming it's good, but theoretically it could be anything. Some people are brutally honest also, I must say. Some people, I have heard stories that are nightmares. But if you're curious just to see what they wrote, you have the option to read it. But you can only read it, and if you do, the program will know, and your preceptor will know. And I have heard, it could be a rumor, but I have heard that it's not a good thing because they think you're not confident if you do that. So this is just like gossip talk that I've heard from people. But just to give you an example, it's actually very complicated, and there's no way they give it to you by hand. You cannot touch it, the letters.
Have any question?
Yeah.
Thank you so much, Doctor. I think we are done. Thank you so much for
Thank you so much
for this
lecture.
Thank you so much.
Thank you so much for everything. Thank you.
ننطلق كل واحد ياخذ الكرسي مالته والكيكه